Good morning, everybody. Good afternoon, good evening to you, no matter where you are joining us today. Thank you for joining us. You are attending the second annual meeting of the Asia Pacific Road Safety Observatory. My name is David Shelton. I am the Road Safety Focal for the Asian Development Bank and the lead for the Secretariat of the Asia Pacific Road Safety Observatory. This annual meeting will be run over 3 sessions starting today. Each session will commence at 1 p.m. Manila time and complete around 3:30 p.m. Manila time. In a moment, we will formally open the event, but beforehand, let me remind you that all the presentations will be available through the event website, and you'll have a link to that posted into the chat. Russian translation is available in the meeting controls on your Zoom. Please note that all sessions will be recorded. And most importantly, I urge all attendees to participate. All questions are welcome and can be lodged in the Q&A box in your Zoom screen. Questions will be addressed during the panel session at the end. Today's first session, we will include the meeting formal opening statements from 3 of the observatory partner organisations, followed by 2 presentations addressing efforts to improve the recording and collection of road safety data. Our second session today is focused on the role of the Observatory National Data Coordinators, and we'll hear some country experiences with road safety data management ahead of updates on APSO's intended data inventory and the WHO's platform for road safety data reporting. Now it is time for us to formally open the meeting. Firstly, I invite Robert Gill, the Chief Sector Officer at the Asian Development Bank, to address the audience. Robert.
Working on my connection. Can somebody tell me if I am audible?
I can hear you fine there, Robert.
Okay, and how about a visual?
Yes, Michelle, can you put Robert on the screen for us? Your camera is certainly on, Robert, and I can see you.
Okay, I'll just go ahead then. I can't tell. My screen is indeterminate. So let me just launch into opening this second annual meeting of the APRSO. So it's truly a pleasure to be here with everyone today at the opening of this second annual meeting. And I am most encouraged to see that the original vision is coming to life. We've been talking about this for a long time, and it's great to see it happening. I would especially like to recognize and congratulate the 21 APRSO member countries represented here today. Your participation is what countries to join and make their contributions as well. The country focals and national data coordinators have a special role to play, and I want to thank you all for your leadership and engagement in responding to APRSO survey requests and providing country road safety information. Your responses have been used to write the observatory's annual report and the report on road safety indicators. We know that APRSO is still a young organization, but we believe it has a huge future ahead. Global Decade of Action has been announced, and less than 2 weeks ago, we saw the release of the Global Plan 2021 to 2030. That plan, which is a guide for all countries, includes an emphasis of the need to increase country capacity in road safety data collection and analysis. The 6 regional road safety observatories, including ours, have a key role to play in building this capacity. So this second annual meeting will take the important step of formalizing a member country-led governance of the observatory. ADB will continue to provide secretariat support, but future decisions will increasingly be made by member countries as a group. This is the same leadership that has been crucial in all countries where great progress in road safety has been made. APRSO is by nature data-oriented in its focus, but it also carries a mandate to promote good practice in road safety policy and action. I encourage you all to see and use the observatory as a place to stage wider policy discussions on road safety matters and to share the progress you are all making at a country level. To do so, there are pressing data priorities to be addressed if we are to achieve the UN global target of a 50% reduction in fatal and serious injuries by 2030. First, we must close the gap between country-reported and WHO estimated fatality discrepancy of 50%, from 630,000 to 1.25 million. We must add consistent counting of serious injury to our trauma data. The UN goal adds serious injury to the 50% reduction target. We must improve crash data collection, especially the geolocating of crashes. And we must start to report against safety performance indicators, such as the 12 voluntary global road safety targets. Most important, however, is to expand our approach to road safety by encompassing the full SAFE system and commit to stronger action to protect the well-being of road users across the region. The APRSO has an important role to play, as does every one of us, to improve road safety data to allow for better informed decisions, policy development, and actions to save lives. You're all making an important contribution to doing all of that. So I thank you for your efforts, and I wish everybody a productive meeting. Thank you very much.
Thank you, Robert. Thank you for joining us this morning, and thank you for your support for the observatory. Next, we have the pleasure of hearing from John Todd, the President of the FIA and the United Nations Special Envoy for Road Safety. John Todd has pre-recorded a video message for us, and I'll ask Michelle to please play.
Ladies, gentlemen, dear friends, it is with great pleasure that I welcome you to the second annual meeting of the Asian Pacific Road Safety Observatory. I'm delighted that the joint commitment of the FIA, the World Bank, the ITF, and the WHO have helped develop a network of regional road safety observatories, which now cover 120 countries. Governments have a primary responsibility to ensure road safety, but they need to be guided by evidence and data. Effective action can only be taken if it is targeted and measured with accurate data. To share best practice and agree on a common approach, it is essential that the collection methods meet international standards and have stability in time. I'm confident that the Asian Pacific Road Safety Observatory will be a key resource for all the governments in the region. In my capacity as President of the FIA and UN Secretary General Special Envoy for Road Safety, you have my commitment to support your precious work. Thank you, and I wish you a productive meeting.
And thank you to John Todd. It's always a pleasure to hear from him, and it's so important for us to have the FIA's support. I'd next like to invite Wyman Wren to address the audience with opening remarks. Wyman is the Director of the Transport Division at the United Nations Economic and Social Commission for Asia and the Pacific. Wyman, welcome.
Thank you, David. Distinguished participants, it's my great pleasure to welcome you all to the second annual meeting of Asia Pacific Road Safety Observatory. Road safety is an issue of serious concern globally, and especially in the Asia Pacific region. 60% of the global road crashes occur in our region every year, which means one person is killed by road crashes every 38 seconds. The economic and social consequences of road crashes are huge, and not only limited to the victims, but also spread over the entire society. So the issue must be addressed properly without further delay. So dear participants, evidence-based policy is a key to address road safety issues at all levels, locally, nationally, and regionally. However, inaccuracy of road crash and road safety performance data is a big challenge for our region. So according to ISCAP Secretariat analysis of the relevant data in 2016, the reported numbers of road crashes in our region were only 46% of the WHO estimated figure, and the fatality rate was 8.4, while the estimated figure of WHO was 18.3. These examples of inaccuracy and underreporting of road crashes have always inhibited our understanding of the extent and impacts of road crashes on our societies. So this needs to be corrected immediately. So dear participants, the United Nations General Assembly has proclaimed 2021 to 2030 as the second decade of action for road safety. As a follow-up, a global task force was set up by a number of UN agencies, including ISCAP, to prepare a global plan of action for the decade. The global plan was launched just 2 weeks ago, with emphasizing the importance of collecting quality data, harmonizing the definitions, establishing the links between different sectors such as police, health, and transport, facilitating the gathering of data as well as ensuring validity of the data collected. The dear participants, accurate data is an essential input for evidence-based policy making. It helps assess how to reduce factors that lead to serious road injuries. It serves as a basic input for the monitoring and evaluation process. It can also help prioritize the road safety interventions and budget allocation. So moreover, accurate road crash data can be utilized to motivate decision makers on the urgent need for actions. So in addressing these challenges, APRSO is a concerted effort by the development partners and road safety stakeholders to better support countries in our region in their efforts on improving road safety. It aims to help member countries to improve the quality of the data collection and the reporting systems. Moreover, it can also help member countries to develop a harmonized database across the countries. It will also foster dialogue and share experience on road safety among member countries in our region. In this regard, we encourage countries in our region to join APRSO. We need champions to lead the initiative. We need transformation of APRSO from a development partner-driven initiative to a member-owned platform for road safety. We need active roles of all members to make APRSO fully functional and ultimately bring APRSO to be a model regional road safety observatory globally. So dear participants, ISCAP has been attaching great importance to road safety. I'm pleased to share with you that road safety remains a key thematic area on the draft new regional action program for sustainable transport development for Asia and the Pacific for the next 5 years, 2022 to 2026, to be adopted at the 4th Ministerial Conference on Transport in December this year. So under the new Regional Action Program, we would like to assist the member countries in improving road crash data management through regional initiatives, including APRSO. We look forward to preparing a periodic progress report on road safety in the region. So ladies and gentlemen, as a co-organizer of the event, ISCAP would like to thank APRSO partners and the Secretariat for their great efforts helping our region address road safety issues. And we look forward to working with all APRSO members towards achieving the target of reducing road deaths and injuries by at least 50% by 2030. Thank you.
Thank you, Wyman. Thank you for your important words. And most importantly, thank you for the support that APRSO receives from UNESCAP. Our meeting is now formally open. I would like at this point to invite Jamie Leather, the Chief of Transport Sector Group at the Asian Development Bank, to set the meeting expectations in advance of our first speakers. Jamie.
Thank you, Dave, and welcome everybody. It's a tough act to follow some excellent opening remarks that has both given some stark reminders of how serious the issue is, particularly in Asia and the Pacific, but also what the organization stands for and the member-owned organization that this is. The partners you can see across the top of my screen, we're here to assist you. And in terms of the expected outcomes, this is the annual meeting. So primarily, it is to update everybody where we are, how we've got here, but perhaps more importantly, what we're doing going forward into the future over the next 12 to 18 months. So we have seen a growing number of membership, and I'm happy to say we now have 22 member countries. Admittedly, this is a young organization, and in the year and a half, 2 years that it's been established, we have all been going through the global pandemic, so a very difficult time. But to get 22 members, the governments have signed up. I think that's a fantastic show of strength from governments across the region, how seriously they wish to take road safety, and also how much they want to share and access information, training, understanding of how we can make a better future and save lives and injuries across the region. I've said already, this is your organization. So over the next few days, we want to hear from you on what you would like from the APRSO. We have a host of organizations, the partners, plus a whole range of supporting entities that can respond as best we can to any of the demands that you may have or wish to put forward. And the discussions over the next few days, I hope, will stimulate your thoughts and put forward those ideas. It really is about what you want to happen and how the APRSO can support you. We also wanted to mention something about the knowledge and innovative practices. Another idea is not just in terms of improving data and looking at data collection, but what road safety actions and innovative practices can be put forward. I would like to say the APRSO Road Safety Management, the online course that has been held over the last few months, 2 modules, but we have had 227 participants in that training program. So again, a great show of the interest that is being raised across the region and the activities in terms of addressing road safety. A couple of other examples, because I think we can learn from our member countries as well. Cambodia and its capacity development program on a very small budget, but working with NGOs to improve road safety. That's a great example that perhaps some of the other countries and future members can look at from Cambodia. In India, on the policy side, the Motor Vehicle Act of 2019, the establishment of the National Road Safety Board. I think that centralization, collaboration activities across many different line agencies within governments is a great lesson that perhaps could be shared and could be implemented in many other member countries as well. And perhaps on the research, I'd like to mention Miros, who are doing some outstanding research, particularly on motorcycles. And this is, in my view, an Asian issue, which requires a solution to be developed probably driven by Asian research bodies such as MIROS. So there's just a few examples of the kind of great work and knowledge and sharing of practices that we can provide through the APRSO. But the next few days, it's the opportunity to discuss and agree what we want and how we're going to get there. I always say it's the data is one aspect, but data analysis and most importantly, taking action to save those lives and reduce the injuries across the region. That is why we need better data. That is why we need to understand what works, how it works, and how we can implement that. And hear from practitioners across the region how they managed to set up such systems, how they undertook that analysis, and how they use that analysis and that data to make better informed decisions to save those lives. So we can share information across the various governments, but also the range of partners and supporting organizations to assist you in that process. That is really what we hope as an expected outcome. We want to hear from you. I think that's the main message, and I'll pass it back to you, Dave. Thank you.
Thank you, Jamie. And I'd like to also acknowledge the great work that Jamie and others have been doing in bringing together the Asia Transport Outlook as a data source for practitioners seeking trend information across all aspects of transport in Asia and the Pacific, including, of course, road safety data. It is now my great pleasure to welcome to the microphone our first presenter for the meeting. Closing the gap between reported and estimated fatalities is a key objective for the Observatory. We've heard some of our opening speakers already mention this. The World Health Organization has opened our eyes with its reports highlighting that over 50% of road crash fatalities go uncounted in official statistics. Dr. Kasim Leitch from the Safety and Mobility Unit at the World Health Organization is here to fill in the detail behind this worrying statistic. Welcome, Kasim.
Thank you, David. Thank you for this invitation. On behalf of WHO, I'm very happy to be here and to share our experience with all the participants. And as Jamie said, we need to hear from the participant, and this is for the participant, and we are here just to share ideas and to share how can we improve the quality of the data. I'm Kasim Ayesh. I'm responsible of the statistics in WHO for all injuries data. I worked for the fourth Global States Report. I'm working in WHO since 2011. Next. Just as we said, yeah, there's big gap between what was reported from countries as official figures and what was estimated by using some statistical method from WHO. As you can see here, just to remember, just the total of that estimated is around 1.35 million. And as you can see, but the reported data is only the half of that. It's around 600,000. If we took just the Asia in the two regions from WHO regions, the Western Pacific region and South Asia, East Asia region, you can see, for example, there is a big discrepancy between reported, for example, in Western Pacific, reported it was around 100,000, but estimated it was around 300,000. And almost the same in South Asia. South Asia, we have as reported data around 200,000, but the estimated is around 400. Here in South East Asia, India is included in this region. This is a big discrepancy, and it's not easy to convince the countries that there is a gap between what is official figure should be and what is published. And next, and among the problems that we noted during the analysis of the data that we received, we noted that a huge definition used for all sources of the data used in countries. For example, we have police record, health facility record, vital registration data, and some combined sources. But the main source, or what we suggest to the country is to use some combined sources. As you can see for here, yeah, almost 70% of all the data that we received from the global states report is from police recorded, and only 2% from vital registration. As WHO, we are pushing a lot to improve and the vital registration data, or civil vital statistics and civil registration of vital statistic data, that we push to improve this quality of the data. And we are working with the countries to improve this type of the data. Doesn't matter if it's birth or death, but at least we can improve the quality of the data. Next, for this, yeah, as a party involved in this road safety, we have civil registration, as I said, and we have police, and we have insurance, and we have some strong point from civil registration, and also some challenges to improve. For civil registration, yeah, they operated with a legal framework. This is good for a point, and also the cause of the death is certified by doctors. This is mean, yeah, we have the real cause of the death. But as challenges that we noted, yeah, this quality of the data is not good in all the countries. I think only 80 countries, over 194 countries improving or giving good vital registration data to the WHO. And also what we noted, the lack of doctor to certify cause of the death. And also some countries didn't use the certificate that WHO suggested, just to classify the cause and to give a good classification by ICD 10 or 11, doesn't matter, but just to give the good classification of the cause. That this will help to have or to record the correct number of the death in the country. Next, we have also a police. Almost all, as I said, like 70% of all the data on all the country is from police, and police yeah, playing a good role just to improve the quality, and also the police are involved 24 hours, yeah, just to receive calls for crashes and for deaths, and they are really in time, and they collect witnesses for crashes. And also the information, we have a lot of information that we cannot find it in other sectors. For example, the type of vehicle, if there is some consumption of alcohol and some drug, and this is good point that we can use it to improve the quality and to have safe road. And so also some challenges that we noted, yeah, there is no follow-up yeah, until, for example, 30 days after the crash, or after 24 hours. And also there is no collaboration with other sectors, health or insurance, and the collaboration is limited. For next among the next challenge, next slide, please. Yeah, for the problem that we have for the definitions used in the same country is a huge. For example, in the health sector, they are using for example, at least 1 year as definition of road traffic death. But for civil vital registration death, for example, there is no limit or there is no definition at all exact. But for the standard definition that the way we suggest to use is 30 days. Based on the data that we received for the global states report, like 60% of all the countries are using a definition of 30 days as interval of debt. And this gives us an idea about how can we improve the quality of the data, where should we pushing this work. And as you can see, for example, here we have for unlimited time we have only 13% 13% of all the countries using this definition, and for 1 year only 5%. 1 year means the health sector using this only 5%. Next slide. Based on this problems that we noted, and the next, WHO developed some steps to follow to help country or to work with the country to improve the quality of the data. Next slide, please. The first point is to map the data system. When I said data system here, we are focusing only for road traffic data. Just to work with the country. We invite almost all the stakeholders involved in road safety, and to work together and to map the data system by using business process mapping, and for example using like Bizagi software. The second point is to link the different data sources sources of the data, and to see if we have the same number of that or not, or if some sector has some data that other sector didn't have it, or something like that. Just by merging this data, we can improve the quality of the data, and after that we can create a system or digital system to share the data automatically instead of just collecting manually or by paper. And after this 2 point, we suggest to update the map that we developed in the first time, because there is the linkage of the different sources of databases. We noted some problems that it is not available, or the people that know that exists, because the problem is when we do the mapping, the first map of the data system, we are following what should be, how the map should be. But when we try to do like practical, to do the linkage, we can see the practical issues and the problem that we've faced. And in the third point, we include theoretical and practical area, and to create the real and how the map should be, and how can we and after that we can develop some plan of action to improve each sector, or all the system if it's possible. Next slide. This is an example of mapping route traffic that we had recently with Nepal. When I said mapping, is we try to map the process when we have a crash. The green circle here means we have a crash. What is the process or the task should be? For example, here the rectangle, the blue rectangle, you have local witness directly called the ambulance or police, for example, here. And we try to write all the steps and the task and to include all the sectors. For example, local witnesses or family or something like that. And after that, and to see where as the data is recorded, and see if this databases are shared between the stakeholders, or if only one data system include all the data, data or not. Based on that, we developed the map. Next slide, please. This is to link or to do the matching or the data from the different the databases. First, we should do some analysis to the data available in each sector and to see which variable are available and which variable that should be used for matching or to link, and to check if the same person who's registered in for example police is the same name or the same age or something like that. The main variable that we use or suggest to use is the name or the ID or the age and the sex, that of crash or that of death, mode of transport, and location of crash, if it's possible to have it in GPS or not. But this is the main variable that should be available in different data sources. In the second point here, you can see an example of the data used, for example, to do matching. Yeah, here, for example, what we noted, we have a lot of data as the name as unknown, and we can have the sex, and we can have, for example, the date of death, but we cannot have, for example, the name, the family, and everything that you contact or something like that. Well, and we cannot merge it. If it's possible, if we want to merge it, it's not possible. But as you can see, for example, here, for example, this person is available, or this name is available in police and the health sector. Health here is hospitals, and also this one is available and is the same as in hospitals, the database, and also on CRVS. This is just an example to give you an idea about the data, that how to merge it and which variable to use. Next slide. As a result of this exercise, we had here the recent exercise or study that we did with in Zambia, where we looked just for Lusaka region, and also the same in Dakar region. We tried to merge the three main sources of the data from police, hospital, and CRVS or firefighter, database. As you can see, only no single database can give just or provide enough information, to record all the data. As you can see, for example, here we have in for Zambia we have around 300 that, but what was as you can see here, but the total is more than 600 if we merge the three sectors. The same in Dakar. We noted we received as official figure is police data, but police data here is covering only 14% of all the data or the data that we received. Health sector recorded 40%, but this means that only one sector is not enough to have. I think the collaboration between sectors and sharing data is the main one to improve the quality of the data. Next slide. With this method of linkage, we had some examples. For example, in Tunisia, reported data as of was 1,300, but when we did the linkage from different sectors, they integrated, we had as estimation is 2,000. It's more close to WHO estimated. The same in Thailand, the reported data from one source, it was around 8,000. But when they integrated the data or they did the linkage, the estimation, it was 21,000. It's close to 24,000. In Senegal, as I said, based on this linkage, we noted that the police data, the completeness of police data is only 14%, and health sectors is recorded 40%. Zambia is showing, sorry, just showing 24% as completeness from police data, and only 5% from hospitals. But in CRBS is better, 18%. The same idea also in Tanzania. We're still working. For Nepal, we didn't finish the work with Nepal, but we will have it. I think by the end of this month we will have some result. Next slide. This is updating the map after doing the linkage of the data set with the sources. We try to include the issues or the problems that we faced there in the collection of the data, and all the problems collecting from police, and the political problem also to get to check the data, and also the ethical approval that we had from sectors, and how to get it also, and how to get the access to the data. This is an example of working with the participant and convince them that just to improve the map and the system. This is as a result. We can see, for example, here a result, and all the red circles, it means that not registers. The process is just finished like that without having any registration. And as first point, we have what we suggest to put for the action plan is to improve this red circles. We should have, and also to work together to merge all this data databases on only one database. Doesn't matter where from for where the position. If having police should have just one databases for all the databases, or just it's up to the country to choose only one sector who can take care of the databases. Next slide. As a recommendation or challenge, as I mentioned, data about traffic fatalities are not robust in many countries, and the reporting, as Jamie and other said, the underreporting is the major problem, and the problem that we are facing also and we should improve this quality of the data. Only few countries, like 41%, reported the use of combined sources of the data. We should improve this combined data. I think it would be good if almost 50% of all the countries, the member states, using a combined sources of the data. This will improve the quality of the data, and also the discrepancy between estimated figure and reported data, it will be short. And also if we have, for example, say this type of the data based on linkage, I think we, in this case here, we don't need to estimate the figure. We should include it as official figure, as a good quality of figure, like CRVS data, like having CRVS data. And countries need to integrate data from health, transport, police, or insurance. And what we noted also, there is all this linkage of the exercise data. Is insurance companies has a lot of data and details to check or to match. But we should use it. I think Thailand used this insurance data, and the quality of data was amazing. It was very, very good at the end, and we should include, because usually in your area, or we don't include insurance companies for this databases. Well, I think we should include them. We should include all the stakeholders that have at least some data or involved. And finally, I think country needs to make an effort to improve CRBS if it's possible. This is the end of my presentation. Thank you. I'm happy to answer any question.
Kasim, thank you enormously. It's a fascinating work that you're doing, and it's great to have an insight into it. It must be terribly challenging to work across multiple agencies as you are. So, so terrific to see that the work's being done. I do have one question for you, and there is also a question in the chat. So perhaps if I can direct you to the Q&A. David Wanty has a question there for you from New Zealand relating to Fiji's practices, and you can type an answer in there directly to David. But I had a question for you about the work that World Health Organization has been doing here. Is there an intention to create a guide for countries to do some of this this work themselves, to bring together the agencies, do their own mapping and improve their reporting?
Yes, yeah. This is the goal is this is the work from the country. Yeah, we are just supporting them. Yeah, this is the country who should do this. Yeah, we are just giving, for example, if they need some expert on this mapping data system, we got them the expert. For Zambia and for Nepal also, they are working on this because the problem of what we noted is to convince all the stakeholders to be together in the same room. Yeah, because what we noted now on police is more focusing. No, our data is the best. We have all the debt. We registered all the debt. Yes, but just some debt is not is not involved. As I said, also the search the definition is you should follow until 30 days. But usually the police just have follow up the injured people until 24 hours or the maximum 6 days. Because they said, we have more urgent issue by security than following injured people if he or she died or not. But our purpose here is just to support the country. If they need anything, just to have. We have some guidance, we have some experts, we have some expertise, and we try to share expertise from other countries. With for example, here we have Nepal, we have Thailand. If any country from Asia wants something, we should contact them with Thailand and through the exercise and share with them what Thailand did, and if there is any support. We ask other donor to support this. This is our goal to improve the quality of the data in the country, to support the country.
Thank you very much. That's great to see that work. We do, however, need to continue to move to our next speaker, Kasim. Can I please direct you to have a look in the Q&A box? There are a couple of questions there that I'd encourage you to please respond to. So thank you very much.
Yeah, thank you. Thank you so much. Thank you. Have a nice day.
Our next speaker is Dr. Anna Vederby from VTI in Sweden. Anna is a senior researcher in traffic safety at the Swedish National Road and Transport Research Institute. She has been conducting work for the ITF and World Bank on assessing safe system implementation. And today, Anna will address development of safe system implementation indicators. Welcome to you, Anna. It's terrific to have you join us.
Thank you very much for the invitation. And I hope you hear me well. As David said, yes, I am a senior researcher in traffic safety. And next, please. The work I will talk about today is from a joint ITF World Bank working group, which is about how to implement a safe system. And this work has been led by Henk Stipstonk from the Netherlands and the head of the World Bank's Global Road Safety Facility, Saeed Dada. And it includes more than 60 experts from 25 countries, international organizations and NGOs. And I will only talk about a part of this work because the main objective is to produce guidelines for practical steps how to implement safe system based on existing cases in low and middle and high income countries. So you can see examples in the guide when it's finalized. And then it also includes a chapter about safe system implementation indicators, and that is what I will describe for you today. And we will also, within the guide, design and conduct some pilot projects, which can be served as a basis to collect further practical experiences. Next, please. So what is then a safe system indicator? We see it as an inclusive framework of qualitative indicators that can describe the stage of a safe system implementation in a country or in a region. And this concept includes indicators of all kinds. They can be just describing different type of interventions that could be used, but also mutually coherent measures to organizational actions, aiming at, for example, cooperation between partners, as we also just heard in the present presentation. It's the cooperation between the hospitals and the police, for example. Sorry, must have muted myself. Next, please. So what did we do then? Well, we had an idea that we should build on basic safe system principles that was developed in the 2 earlier ITF manuals that you might be familiar with. We, so to say, combined key elements and the road safety pillars, and I will describe them just in the next slides. But we also wanted to cover road safety management and institutional framework, which we see as a policy dimension. So we try to create a framework, a sort of a matrix structure that covers 3 dimensions. It's the pillars, it's the key elements, and the policy dimension. And we can see this framework as a sort of a structured approach to describe the stage of the safe system implementation. Next, please. And how does it then look? Well, as I said, we represent it in a matrix. So we have the key components and we have the pillars. And the key components that we are dealing with is the institutional framework, which describes parts that are important to avoid system failures. We also describe the shared responsibility, meaning how do we avoid blaming the victim? We also describe how shall we strengthen all parts and not having silo measures, so that we should avoid isolated measures. We should have a cooperation and integration between measures and different work that is done. But also one crucial part in the safe system approach is that we should prevent large forces. Crashes shouldn't be fatal. And we also have this part to support safe road user behavior, meaning that we're tuning the task to the human competencies and simplify it for the road user. And the pillars that you probably are familiar with. The first pillar, we added the road safety management, and then it's safe roads, safe vehicles, safe speed, safe road user behavior, and post-crash care. And so we can see that we have a matrix here with 30 cells. And for each of these cells, we have briefly described what are important parts in an emerging state, in an advanced state, and in a more mature stage. Next, please. And in this guide that is being produced, we describe this framework at 2 levels of details. First, it's a high-level strategical framework, which is a more conceptual description of what you can expect in each cell. So it's a very generic description, not giving any details, more just to see what is this cell about. So we have these 30 descriptions for each of the cells, but then the guide also will cover a more detailed framework. And this is to allow the framework to be applicable to real situations. And Here in this level, we have descriptions of what road safety situation you can expect in each cell, and for each of the 3 stages of implementation that I just mentioned in the previous picture, the emerging, advancing, and mature. And I will give examples of this just a little bit later on. Next, please. So how can we use this framework? Well, we see it. The idea from this working group is that it could be a general guidance about what kind of interventions that should be considered by countries applying the SAFE system. But it can also be a tool to analyze existing cases of SAFE system implementation. This can be a sort of encourage improvement of different cases that you have in your country or in a region, but also look at the lessons learned and can give guidance about possible future steps. And I can mention that this is done within the guide that will be produced. So we have concrete cases that are analyzed based on this framework that we have developed. But it can also be used to assess pilot projects to be undertaken, to see that you don't miss important parts and help to improve the SAFE system content of the project. Next, please. So this is a description, and I'm not expecting you to read what is in this picture here, but just to give you an overview of what is covered. We have this matrix from the beginning, 30 cells, as you saw earlier, and we have different types of indicators, so to say. So we have also a color scheme, and this color scheme also represents working groups that developed the descriptions in these cells. So we had 3 working groups actually, all looking at different parts of the matrix. And if we look at the gray cells, they are considered with institutional framework and road safety management. So they can be considered as input, cover, as I said, management and organizational conditions for a safe system. That they can be describing standards, road safety programs, etc. The dark purple parts is more the output, organizational output, describing cooperation and partners and how to integrate the components of a safe system. And the light purple cells is more the operational output, describing intervention to actually decrease the road safety risk. So they can describe vehicle systems, medium barriers, etc. Next, please. And I will give you some examples of the detailed framework so that you know what you can expect and what level of details. So I have chosen 3 cells that I will show for you. So in this detailed framework, as I mentioned, we have 3 stages of implementation: emerging, advancing, and mature. And if we go to the safe vehicles and institutional framework cell, it's the next slide. So the picture is just showing you where we are in the matrix or in the framework. So in the emerging state, it's described that prevention of system defects in relation to safe vehicles is organized by starting to apply registration and inspection systems to all new and second-hand important vehicles using the UN vehicle agreements and their most important regulations and rules, combined with consumer information activities and requirements for vehicle insurance. And if we go next, we see that there is also a description of advancing and mature implementation stage. And you can see what is added. Next, please. So if we look at the part strengthen all parts, all pillars, we have merged these cells together since it's all about cooperation and integration. So In the emerging part, it's described that road safety professionals understand that road safety is a function of the interaction between all pillars, meaning roads, vehicles, road users, speeds, emergency healthcare, and the management of all these pillars. And following, I will not go into these details, it's also in the advancing and mature stage, there are descriptions. Next, please. And if we look at the prevent large forces and safe speed cells, in the emerging states, it's described that speed limits are implemented on all roads, and there is an ambition to lower speed limits, especially in urban areas with many vulnerable road users. And speed limits are also adapted to different vehicle categories, meaning lower speed limits for trucks, buses, and vehicles with a trailer, for example. And further descriptions in the advanced and mature stage. And as I said, we from the beginning, we had 30 cells, but then we merged the strengthen all part cells for the road safety pillars. So for all of these cells that you see in the picture, you can find descriptions at this level of detail. We also started with a even more higher level of detail, but for now, we thought that it was not possible to include all these details in this report that we are preparing. So next slide, please. So the next steps for our work within this ITF and World Bank cooperation, there will be a draft final report by the end of December. There will be a review process and approval procedure in mid-February. So the publication of the report is published by expected in the first half of the next year, 2022. So thank you very much for listening, and also thank you for the invitation. Here in Sweden, it's not it's early morning, so it's completely dark outside. So, but the day is just to begin. Thank you.
Excellent. Thank you, Anna. Thank you for that presentation. We have some questions for you, and can I encourage the participants, the audience, if you have further questions for Anna, please pop them into the chat. I'll just refer to a couple of these as a starting, Anna. David Wanty in New Zealand wants just to confirm your reference to region. Is a region in your model part of a country, like a state or a province, or are you talking about a global region made up of countries?
No, we thought more of it as a part of a country, so state or province. Yeah.
Great, thank you. The next question is from Subhash Nigam, and this is a wonderful question, and for some I think a tricky one. The safe road user behaviour grouping pillar part. Are there case studies to strengthen the assumption that such changes can be brought about, and is it an important key element?
I think that we have. I'm not sure if about the cases, if it's included. It's included to some part in the report, and I can look it up and also answer in by email or so. But what we have tried to strengthen here, that what we mean with this safe road user behavior, it's how do we create a safe system that support a safe road user behavior. So we are very keen on not blaming the road user. So it's not, that is not described, but how can we as a system or as partners or as organizations trying to implement a safe system, how can we create a system that supports safe road user behavior? So, and that is an important part. So we really not want to put the blame on the victim or the road users.
Yeah, great. That's a I understand entirely. That's an excellent response. I just wonder here whether it's also worth pointing out for Shubash, in the event that that person is not aware, the World Bank has recently published a very good, concise document on what works in road safety, and they address each one of the parts of the SAFE system. And just as in other parts of the SAFE system, within the road user behaviour area, of course, there are interventions that have been shown to work and some that have been shown not to work. So one must be very careful both how you choose your interventions to address the specific crash types that you have, but also how you implement them, because even an effective intervention can be poorly implemented and lead to something that doesn't work. There is also quite a bit of debate about the short and long run differences in where the heavy lifting of road safety falls with respect to the pillars. And so if I might describe that as, in the long run, and here I'm talking about the 2050, 2060 sort of horizon, we do expect that infrastructure, speed, and vehicle safety features will do a lot more of the heavy lifting in producing road safety. For some jurisdictions, they're already seeing that in their road system. In the near term, for many Asia Pacific countries, particularly where it's going to take a lot longer to transform infrastructure, there is a near-term focus on this issue of road user behaviour that includes the conceptual shift to not blaming the victims of crashes, but also ensuring that our enforcement practices are sound and that we are indeed having positive behaviours resulting from our enforcement practices. So that's certainly very important, and you can get some very quick wins from good and sound enforcement. I have a question for you, Anna. As I look at this work, for me, it brings to mind the World Bank's work on road safety management capacity review. And I thought you might just respond to the question, what is the relationship between the work that you're doing and the previous work that's been completed on capacity reviews? We've seen capacity review as a process used globally in countries of all different levels of development. It has been shown to be an effective and a sound process, but it is quite a heavy process to conduct at the same time. Are you able to comment on the relationship between the work that you're doing and that process developed by the World Bank?
Yes, I think that the main goal for this work with the ITF and the World Bank together is to sort of create a little bit more practical guide, that you should have examples from cases that you can be inspired from, and that you can see what has been done in other countries similar to mine. So that I think compared to the earlier work, we of course try to build on both what is done in the World Bank, but also in the ITF reports, but have it a little bit more practical. At least that was the goal. So more like a guide, what so to say, this guiding, so you're looking in a quite easy way to see what are important parts in this cell, and that you also have quite easy the whole picture. It's of course not possible to have the whole picture, but at least we try to capture important parts in a quite precise, condensed descriptions. And since there are many different partners that have been involved in this work from different parts of the world, it's not an easy task to have this all this cooperation, but I think it has been quite a great examples of how we can work together, even in the time of COVID and only meetings online. So it has been a great cooperation, and still is, since we are not finalized yet. But
yeah. And for those who haven't had the opportunity to be present in these meetings, I've only attended one of these, and the working group for Anna's work is like dozens of people from around the globe. It is extraordinary, really, the bringing together of expertise from right around the world in this, and it's a real pleasure to see it happening. And I have some more questions for you here, and they really go to the issue of integration of parts of the safe system. And so I'll give you the two questions wrapped into one. So the first part here is Hamid says, can you talk about road user behaviour with respect to inbuilt systems in vehicles that provide guidance and promote good behaviour? And then secondly, David Wanty says that, of course, self-explaining roads are also an example of physical infrastructure that has been specifically designed to evoke safe behaviours. How does the model deal with these sorts of crossovers?
Yes, I think we have tried to cover both these parts. I mean, in the vehicle parts, it's if you look at the column in the pillars, the safe vehicles, we have tried to describe different parts in relation to the key elements, and also covering systems in vehicles that can guide road users, but mainly systems that of course we cannot cover it all in this quite a brief descriptions, but there is described how different system that should be implemented in the vehicle. So we have had experts within this area within the group. It's not my personal area of expertise, but we have had experts within this area looking at what kind of standards and what, for example, organizations like NCAP, Euro NCAP, Asian NCAP, and things like that can assist to. And the self-explanatory roads, that is also a part of the framework. We try to describe that you should have different types of roads, that it should be possible to distinguish between different types of roads, and that should also give you guidance about what is a safe speed. So in the safe speed parts, it's described how you could think of, I mean, for example, if there are areas with many vulnerable road users, a speed limit of 30 kilometers per hour is recommended. And if you allow head-on crashes, I mean, just having an ordinary rural lane, the speed limit should be below 80, for example. So and then the road users should be able to see what kind of speed is expected. But that, as we know, is not such an easy task. I mean, we work trying to make the roads be more self-explaining, but it's not always easy. But that you have different roads for different speeds. That is also described.
Lovely, good, excellent. Anna, thank you very much for your presentation and for responding to the number of questions that we've had. It's fascinating work, and there's clearly a lot of interest in it. We look forward to your report.
Yes, thank you very much, and have I wish you a fruitful meeting. Yeah.
Thank you very much.
Thank you.
This completes our first session of the Asia Pacific Road Safety Observatory second annual meeting. Thank you to our speakers. Thank you to the audience for your questions and participation. In this first session, we have heard that there is a compelling case for the work of the regional road safety observatories, especially in this area of closing the gap between reported and estimated fatalities. And soon, no doubt, that will also be applying to serious injuries. The APRSO's efforts rely deeply on the participation and sharing of our member countries, but also, as we hear, on the collaboration between agencies within countries. Special message there from the World Health Organization. Institutional capacity indicators can tell us how well our organisation is equipped to implement the safe system approach and to reduce further death and injury in the future in our road system. However, it's very important that we not only monitor and measure our capacity, but but that we're taking the necessary action to respond to what those key performance indicators are telling us. So thank you to our speakers and participants in this first part of today's session. We're going to take a short break now. We will break for, what are we on? 15 minutes now. I think we've actually gained a little bit of time. It's a little bit under 15, a little bit over 10. And we will reconvene at 35 minutes past 2 Manila time, 14:35. Michelle, please correct me if I have that wrong, but I think I've got it right. 14:35 Manila time, correct. Thank you. See you soon. Hello, everybody, and welcome back to the second annual meeting of the Asia Pacific Road Safety Observatory. For those who have just joined us, my name is David Shelton. I am the Road Safety Focal for the Asian Development Bank, and I lead the Secretariat for the Observatory. I mentioned at the head of our last session the Asian Transport Outlook. This is a large data library that has been developed by the Asian Development Bank to strengthen knowledge on transport throughout the Asia Pacific region. Perhaps, Michelle, when you get a chance, you can post a link to the Asian Transport Outlook into the chat for people. Thank you. Our next session is designed to shed light on the role of our national data coordinators by spotlighting work at the country level. We also have a speaker from one of our sister regional observatories joining us. Let me remind you of the house rules as we start. All presentations will be available on the website for the event. Russian translation is available in the meeting controls through the Zoom screen. The sessions are being recorded. And most importantly, I urge everybody to participate through the Q&A box to enter your questions there, and we'll ensure that we get across to all of those. Our first speaker in this session is Tran Hu Minh from Vietnam. Tran Hu Minh represents the National Traffic Safety Committee of Vietnam. He will speak to us today about Vietnam plans for a National Road Safety Observatory. Welcome to you, Tran Hu. It's terrific to have you joining us today.
Thank you, David. That's great.
First, I cannot hear you there. Are you?
Oh, okay. Can you hear me now?
I think you may be on mute still.
I already turned on the micro. I see the signals quite good.
Michelle, are you able to assist there? Oh, we can hear you. Excellent. Good.
Okay. Can you hear me now?
Please proceed.
Okay, that's great. Thank you. Many thanks, David, and thank you for the great workshop. First of all, Dr. Hùng he's Executive Vice Chairman of National Traffic Safety Committee of Vietnam. He would like to share our views. He's apologized because he's planned to attend this and present this during the meeting, but for a reason, so he unable to attend. So I am Tran Hu Minh. I am Chief of the National Traffic Safety Committee office. I will present this presentation. Next, please. Yes, my presentation will have some main part, but I will focus on the third session, is the road safety data collection, analysis, and management and use in Vietnam, present and future. Next, please. I guess many of you have already been in Vietnam, and a population almost reached 100 million, and also motorized rings rate is very high. If we combine a motorcycle and car, so at the moment we have only 4.5 million car, but almost 70 million motorcycle. So motoring ownership, almost 600 motoring vehicle per 1,000 person. Next, please. So that pose a lot of challenge in road safety. Now, in term of road safety achievement, Vietnam achieved a lot of positive results in terms of road safety. Now, if we look at the data for the very long time, since 2001 until now. We can see the, all the statistic data go to positive trend. Crash, fatality, and also injured person reduce year by year. Next one, please. However, when we go to the the WHO estimated data and also official data, we can see a very big gap. And based on some comparison, we can see the now. If we look at this figure, now we can see Malaysia is very good. Now there is a difference between the WHO and official data is almost almost the same. Indonesia and Thailand 10 years ago the difference quite big, but now they almost the same. So they are going on the right direction. But when we look at Vietnam, now the gap is getting bigger and bigger, and seem to be the biggest at the moment. So that's a serious issue we are looking at and try to find solution for that. Next, please. Yes, because of that, so when we put Vietnamese data on the global context, we can see if we use the official data, Vietnamese official data, then road safety in Vietnam is very good, equal to Europe. But when we use the data from hospital and also from the local authority, this means book ASIC from the health sector, then the Vietnamese level, the yellow one, now equal to the average of the world. But when we use the WHO estimation data, then Vietnam is almost the highest one. It's the red color. So of course there are many reasons for this, but the big difference, the main reason is the big difference in crash definition and also fatality. At the moment, Vietnam's use the fatality definition is data with other side only for mainly for that. But in the world, many countries use the definition that die within 30 days. So that create a big difference in statistic. Next, please. So now our plan in road safety data collection, analysis, management, and use. Next, please. As you know, Vietnamese Prime Minister last year issued decision 2060 is a national road safety strategies nationwide. And within that, there are many detailed and comprehensive solutions. And at the moment, we are NTSC office is working closely with the counterpart to finalize the action plan. So this action plan is being drafted. And also, the NTSC is preparing the reporting regulation to make sure that data from different resources will be gathered and saved and processed properly. And also in the Vietnamese context, very soon the National Assembly will review the current road transport law and may issue the new one. So all of this is a legal base. It's a very concrete legal base for the data collection, analysis, and management and use of the road safety data. Next, please. As you can see, the National Road Safety Strategy 2030 not only dealing with the 5 pillars, but also use a comprehensive system approach. And we accept that human can make mistake. Next, please. So all the forgiving system, 5 pillars, integrated solution recommend from Stockholm Conference and early 2020, already integrated in the national road safety strategies. Next, please. So when we talk about road safety, we identify not only crash data, but also all the necessary data for road safety to make sure that it will be helpful for all stakeholders, including decision maker, authority, researchers, also the audience and people, even people. So it's coming in terms of road safety management. It's come regulation is coming from Ministry of Transport, Ministry of Public Security. In terms of road safety infrastructure, the data is coming from mainly from Ministry of Transport, but also Ministry of Construction and local government. In terms of vehicle data, is coming from Ministry of Public Security in terms of vehicle registration, and also Ministry of Transport in terms of vehicle technical standard and inspection every year. Road users education is coming from Ministry of Education and Training. Driver and licensing system is under Ministry of Transport, and all the public awareness campaigns is NTSC and Ministry of Information and Communication, especially post-crash responses. Now, crash site investigation is data is coming from traffic police and also local police. Injuries treatment as a hospital data is coming from Ministry of Health. Next, please. So in National Road Safety Strategy 2020 and 2030, the government already identified clearly a solution to build and connect, improve the national database for road safety, and new center for analyzing road safety national database, and use technology to combine crash data at site and data at hospital at all level, as a national level, province, and at district level. And we also have a lot of data from GPS at the commercial fleet. So camera and GPS system, we find, process, and share within the transport inspecting, traffic police, and transport authority, a different level. Enforcement data is connected within registry, register, and driver licensing system all together and share. Road safety reporting, analyzing at national level and province level. So all of it will be put in action plan, which are being drafted at the moment. And we are very keen to share with you in future progress and output of the action plan very soon. Next, please. So this is a structure of the the national database for road safety. So all data coming from different sources will be stored at each ministry, but also shared to the national road safety portal. And from that could be used for the government, could be used for researcher, advocate, academy, and NGO. Next, please. So that's the update from Vietnam, and we are very keen to discuss this topic with you. Thank you very much.
Tran Hu, thank you very much. There's a huge body of work going on there in Vietnam. It's very encouraging to see. We do have some questions, but can I ask, perhaps you can wait till the end of the session, and then we'll have questions from our three speakers. I appreciate that. Thank you very much once again, and it is impressive to see what you're doing in Vietnam. Thank you. Our second speaker in this session is Neil Thompson from Australia. Neil is the Director of Data and Analytics within the Australian Office of Road Safety. He's also the APRSO National Data Coordinator for Australia. Neil will speak to us today about Australia's plans for a national road safety data system. Welcome to you, Neil.
Thanks, David. Thank you everyone for having me today. I'm here to talk about the Australian Road Safety Data Hub. The hub is part of a broader effort by the National Government of Australia to deliver and coordinate road safety policy and investments to reduce death and serious injury on our roads. The hub itself is set up to bring together data from our 8 states and territories and the data that the national government holds to produce a single coherent view of the state of road safety in Australia. And you can see there that that's our stated purpose on the slide there. Could I get the next slide, please? The Data Hub has 4 main objectives. The 2 that I'd like to highlight here are the monitoring and evaluation of our national road safety strategy, which is looking at reducing our national our fatalities by sorry, I'm going to get caught up here. Reducing our fatalities and serious injuries over the next decade. The Data Hub has a critical role in measuring progress of the actions that are going to get us towards our targets. And the other thing that I'd like to point out is the enabling collaboration among government, industry, research, and community stakeholders. We have a significant role in being able to provide data to the research community and other groups, because they're the ones that will be driving the changes that we'd like to see in behaviour that will really get us down to those Vision Zero outcomes that we're looking for by 2050. Have the next slide, please. So the Data Hub itself has been in existence for only about 8 months. Our initial focus has been on making the data more discoverable, accessible and usable, the data that we do have available. I'm sure everyone here, or at least most of you, would agree that having data is fantastic, but without being able to interpret and communicate the insights that you can derive from that data, you're never going to be able to inform good policy making or good investment decisions that will improve road safety outcomes over the longer term. So going forward, our focus is going to be on collecting and reporting data to monitor the progress of our national road safety strategy for the next decade. We'll be working with our state and territory colleagues to develop common data standards and governance processes. That's one of our large challenges at the moment, is that we have 9 participants in provision of data, and they all use different systems that were never designed to talk to each other. So making that coherent and as efficient as possible to create national data sets is a key outcome for us. And finally, we'll be working with that research community to further research outcomes. Can I have the next slide, please? So you can see more about the Data Hub, view some of our latest products online, and happy to take questions. Thanks, Dave.
Neil, thank you very much. It's another huge endeavour. I particularly love the data visualization in the hub that really brings the data to life and helps us capture insights. So listen, congratulations on what you've achieved so far, and I look forward to seeing further progress there. Can I also ask that you stay on the line, and we will have a Q&A session after our next speaker. But thank
Absolutely.
you very much, Neil. I now welcome with great pleasure Alvaro Gomez from OISEVI, the Ibero-American Road Safety Observatory. OISEVI formally came to life with the signing of its statute in 2012, so we're keen to hear about the journey of OISEVI and what lessons this may hold for the Asia Pacific Road Safety Observatory. Alvaro, welcome. It's great to have you with us.
Thank you very much. Hello to you all from Spain. I'm very glad to be here, and I thank you the invitation to join the annual meeting of the observatory, and to be able to exchange and discuss practices and experiences with you. So I try to be brief. I would just like to point out some challenges regarding data that we are facing in the observatory, in the Ibero-American Observatory, and how we are trying to cope with them. I think that, well, I will speak from the point of view not of a national data system, but from the point of view of the challenges that countries face when they try to put their data together and try to compare the data and analyze data. So I think that there are 3 or 4 key points. The first one is what type of data, because we are not talking about not talking only about crash and casualty data, but also about exposure data and key performance indicators data. And of course, we have some international targets that many countries have already endorsed. We have a huge target of halving fatality and injury data by 2030. And many countries have endorsed that target, and of course that means that we need to have accurate data to monitor the target. And we also have the 12 voluntary performance targets that well, many countries are using as a reference to collect data on speed and seat belts, alcohol, infrastructure, and so on. And that means that we also have to look very closely into that. So when it comes to crash data, we have the issue of the quality of fatality data and the representativeness of the fatality data, and I think that's also been dealt with in the presentation from by the colleague from Vietnam. And of course we have a big reference there in the WHO reports, and we need to work into linking databases in order to close that gap between sources. And of course we need to look also into injury data if we like to monitor the target of halving the number of injuries. And that means that we need to use hospital data whenever possible in order to join that source with police data. When it comes to comparability, we have some issues about definitions, and there are some key variables that pose some challenges when comparing data between countries. For example, regarding the type of vehicle or the type of road, it's very well, not every country has a national statistics about urban and non-urban crashes, for example, and when they do, definitions are often different. So and the same happens with the type of vehicle. So we are trying to solve that issue or to explore that issue further by working with microdata, and we have a working group with 5 Ibero-American countries that are that have already started to share microdata on crashes, and we are working with a common questionnaire based on the European CARAS with a shorter list of variables, and we are So these countries are exchanging their microdata, and they are looking at definitions and looking at values of variables and so on. And so we hope to have some results by next year. And another challenge with data, it's geolocation of crash data. This is crucial to applying road infrastructure safety management procedures to locate black spots and so on. So this is also something that we are trying to look into. So the representativeness of the data of course, fatality data, but also non-fatal crash data, the comparability of definitions, the geolocation of crashes, and then coming back to key performance indicators and the monitoring of the voluntary performance targets, how to apply common methodologies to all countries involved in the observatory in a cost-effective way so that we can monitor the target and perform comparisons. I think that these are four big areas of data that we are trying to work in, and of course we hope that we will be able to exchange practices with all these in the coming months and hopefully in the coming years. So it's very good to be here. I again thank the invitation, and I remain at your disposal. Thank you very much.
Thank you, Vero. Particularly interesting to hear about the sharing of microdata, and I'll come back and ask you a question about that in a moment. But first, let me open up to the panel more broadly. There was a question posted in the chat by Blaise Murfitt about the collaboration and coordination across agencies. We know that establishing road safety data management at a national or regional level requires a huge effort in coordination of multiple government agencies. So I'd like to hear from each of our speakers about how do you proceed, how do you get started, and what are the keys to success in this collaboration on data? In particular, how has data been used to help make the case or be shared to inform collaborative approaches to road safety? Perhaps, Tran Hu, we might start with yourself.
Yes, yes. I'm sorry if some noise coming from my side because there is a big construction site nearby. Sorry for that, but nothing you can do. Now, in terms of first of all, the question about the global plan for the decade of action, 2021 and 2030. Yes, we. When we Vietnam sent a team to the conference in Stockholm early 2020, and we also declare very strong commitment to the proposal from the conference. So during the process of the strategy building, we already include all the strategy and recommendation from the global plan. So we already got them in the strategy. Secondly, we are updating action plan, reviewing updating action plan every year. So if we see any new something like best practice from the global context, then we're happy to consider and include them in the revised plan. So I think that's a very good one. We need to bear in mind. Second one, the question from Blaise, engage the government stakeholder from this different agency to step in and develop a multi-pillar strategy. Yes, I completely agree with that because we see cross-sector is very important, and that's the nature of road safety. So we certainly need a multi-pillar strategy And that's why in Vietnam, we have a National Traffic Safety Committee chaired by that standing Deputy Prime Minister. So basically, he's on behalf of Prime Minister to chair, to connect and direct different ministry and different branches to combine together to maintain road safety. So for example, in Vietnam, drug and driving issue is becoming more and more serious. So we will need data from public security. At the moment, on database, we have 230,000 people is addicted. So we need that database and synchronize with the driver license database to make sure that we identify clearly who has the addicted history, and we check it carefully, make sure that they are clear before we issue the driving license with them. Thank you.
Excellent, thank you. Thank you very much for that, Tran Hu. Can I ask Neil, would you like to respond also to this question of what works well in working across agencies or states and getting a coordinated and collaborative approach?
Absolutely, thanks, David. Collaboration is key. The way to get people to share their data is for them to understand the problem and share the problem as well. I think also one of the key learnings that we've taken away from some of the work that we've been doing early days is defining a problem that you're trying to solve, just as a way to break the ice, to build some trust, and to get quick wins. It's fair to say that there are endless numbers of problems, and if you try to solve them all at once, you won't solve any of them. So being able to focus on something that's important to everyone, that's involved in that exchange of data, is critical to success.
Thank you very much, Neil. And Alvaro, working across countries, as well as between agencies within countries, no doubt. You've got to the level where you're sharing microdata on crashes. That's been quite a journey. What has been your experience, and what do you find has been key to cementing collaboration across countries?
Well, I think that ours is mainly a collaborative effort between national road safety agencies, and I think that the key factor is that everybody is willing to learn from other countries. So the willingness is there. You just have to find a way to channelize that and to define a common project. But I think that most countries there or face similar challenges, and once you define a common goal, it's relatively easy to engage agencies into a collaborative effort. So I think that's the key point here.
Yeah, excellent. Thank you. High-level leadership, so crucial to so many things in road safety. I wanted to get one last question in here. This is from Maricela from the Global Road Safety Facility. Interested here in what specific technologies or systems have been necessary for you to make progress in collaborative management of data. And again, I think let's go to each speaker just briefly. Tran Hu, are you what specific technologies and systems have you been able to apply or needed to apply in Vietnam? I'm sorry, Tran Hu, are you with us? I cannot hear you. Perhaps while Tran Hu is working on that. Neil, would you like to respond to that question about specific technologies and systems that have been needed?
Sure thing. I don't want to make light of the question, but I think that the most useful piece of technology is the telephone, or Zoom, or any sort of communication device, because really it's about understanding where each participant is coming from, the different sort of, whether it's about legislation and policy for the sharing of data, whether it's about understanding the technology and systems that underpin the storage of their data. All those things are essential for bringing together the data into a national coherent picture. You know, we aren't doing things, we're not building a metaverse where we're not using AI at the moment. We're not doing in-depth modeling. We're really at this stage just trying to bring that data together into something coherent so that it can be reused as much as possible and save our research colleagues and colleagues in our other jurisdictions from going through the effort of compiling that data into a single source.
Terrific answer. Thank you, Neil. Alvaro.
Well, I think that this is a common topic for regional observatories. And I think that finding a technological tool to share data, to conduct common analysis, to visualize data, we are only starting to work with that. And I believe that this is a field where we can learn from each other. I mean, we have what technical solutions there are to upload data, to share data, and to make an analysis and reports. So this is something where we are beginning right now, and I think that it will be very interesting to discuss common solutions between regional observatories.
Yes, indeed. Thank you. Tran Hill, are you still with us? I've now got two questions for you, actually.
Yes. Sorry. Okay. I missed your previous question.
First question. What technologies or systems have been essential for you in your data management? But my second question is, one moment, my second question to you is relating to governance. What was important about your governance structure to create success, and perhaps even the regulation that you introduced on the regulation of the NTSC and how that addressed reporting? Perhaps you can answer those questions. Thank you.
Yes, thank you. Many thanks for your question. You know, at the moment, I think that because we have different data source and different ministry use different technology to collect and save the data. But of course, the main crush data is with the Ministry of Public Security. Fatality, injuries, analyzing the reason and underlying cause. So all of this is from the Ministry of Public Security. When data is when the crash is recorded, so data will be recorded on paper, and they will be filed at the province level. And then from province, the data will be put on the spreadsheet and transferred to the central government. So we think that we need to use the advanced technology to make sure that we can collect and store the data more efficiently with the geo reference data for use. I think it would be better in future. Now, in terms of data share and use, it's very necessary for the Vietnamese government to issue regulation to make sure that all the data will be stored, collect, store, and manage, and especially share properly. Otherwise, the data will remain within one or two ministry, and when data is not be shared properly, then you know that the decision will be affected because it doesn't have enough data to decision make for the decision maker. So in Vietnam, we need to improve not only the data and the technology to collect the data, but also the ECO regulation to make sure that we regulate how data is collected and shared between stakeholders.
Lovely, thank you very much. And we must close this part of our session at this time, but lots of questions, very interesting material. It's great to hear from each of the speakers. Thank you very much for your presentations and your responses.
Thank you.
Let us now move into our next round of speakers. Speaking on the APRSO data sets and WHO data reporting. Merrick Pala is a Philippines-based consultant working internationally for the World Bank and the Asian Development Bank. Merrick has been supporting the establishment of data practices and systems at APRSO, and he will speak to us today about this task. Merrick.
Thank you, Dave. Hello, everyone. I am Myrick Paala again, and I am here to talk about how we use data in the APRSO. Next slide, please. By way of background, first, I would like to point out that one of the primary responsibilities of the APRSO is to be able to collect, manage, and analyze data in the Asia-Pacific region. Through this data, the APRSO would be able to develop and implement effective research and technical assistance for countries, as well as targeted and customized capacity building on road safety. This data is also able to enables the APRSO to monitor the progress not just of individual countries in terms of road safety, but of the whole region, and to promote good practice both nationally and regionally. Next slide, please. The importance of data has been emphasized in all of the previous presentations, but I would also like to point out that it is also important for the APRSO to be able to collect, manage, and analyze regional or region-wide data. Regional data allows the region specifically to monitor the progress of the individual countries and of the whole region. It allows cross-country comparison on road safety performance, which promotes not just healthy competition among countries, but also allows countries to collaborate with each other in order to improve road safety situations in different contexts. One of the important things about having regional data is the identification of regional issues or common issues among countries and emerging issues as well, so that as one region, different countries can collaborate in order to address these common issues and in order to stop emerging issues from worsening. Regional data also allows us to be able to understand contextual issues or improve our knowledge on risk factors that specifically affect countries in the Asia Pacific region. So for example, what types of safety risks are often experienced by people from Asia and the Pacific. And finally, it allows us as a region to set regional targets and priorities and monitor progress. Next slide, please. So coming from this, the APRSO actually tries or have been doing a lot of activities in collecting and managing data from different APRSO member countries. And this data is not just limited to crash data. It includes safety performance indicators, which cover speed, drink driving, helmet wearing, among others, and process implementation or output indicators, indicators which enumerate or identify the elements or the activities that are being done so that road safety is upheld in each of the countries. So this includes what types of policies or legislations are implemented, what types, how big is the budget, is there a road safety unit, national road safety unit, among many others. Next slide. So let's focus first on outcome indicators, specifically on crash fatality records or numbers. And this has been emphasized over and over again that there is the reality is the crash data or crash fatality data that we have is severely underreported. Next slide. And this is a big problem in Asia, where it's at least 50% of crash data is or crash fatality data is underreported when compared to the WHO estimate, which is just one of the many estimates that are available in the world. And in reality, it is just an estimate, but it can be used as a guide for countries to improve their data. Next slide, please. And when we take a look at the APRSO member countries, we can see that throughout the decade, the last decade, many countries have already tried to achieve to bridge the gap between the WHO estimate and the reported fatalities. But there are also countries who would still need some help in improving the collection and analysis of their crash data or crash fatality data. I would just like to point out that the only available data, at least widely available or widely accessible data, are crash fatality data, and even this is underreported. But the other crucially important type of outcome indicator, which is injury data, specifically serious injuries, it's not something that is easily accessible or being currently widely collected by different international organizations as well. So it's something that we can consider moving forward. Next slide. And one of the things that we did in the APRSO is to publish a report on crash data elements and road safety indicators. And one of our primary recommendations is to take a gradual approach for countries to improve their data. This is similar to what Alvaro has mentioned earlier on OISEVI on having a micro data set. In the APRSO, we have recommended for countries to focus first on a core data element set for crash data. So the really important data that police should or any other reporting entity in a government should strive to collect, perfectly collect as a first step. So this includes crash identifier, date, time, location, among many others. The next the next stages would be the expanded data set. So once the core data set is something that the individual country has successfully collected already, then they can move on to expanding this data set. And finally, the integration or the data set that will leverage existing database systems to collect the other types of data. So for example, collecting road infrastructure data from road bridge inventory database systems or asset management data systems, collecting driver data from driver licensing database systems, and other similar data sets. Next slide, please. Also in the APRSO, we have recommended the collection of safety performance indicators on the country level and on the regional level. And we have patterned this after the UN targets, voluntary targets. So the UN has provided targets on different aspects of road safety. And along with each of these targets, there are indicators that are recommended. So for example, on speed, it's the free flow average speeds collected through observational studies or spot surveys. On drink driving, it's the number and percentage of severe injuries and fatalities that are caused by drink driving, which is derived from detailed crash data, and among others. Next slide. And from this preliminary list provided by the UN, we proposed in the APRSO specific safety performance indicators for the Asia Pacific Road Safety Observatory countries, member countries. So for example, and this covers speeds, drink driving, drug driving, helmet wearing, seatbelt wearing, child restraints, distracted driving, vehicle data, road infrastructure data, post-crash response, and post-crash response. And as you may be aware, in the past few months, we have sent out questionnaires to different countries. And happily, we were able to receive at least 10 responses or at least 10 completed questionnaires from member countries. And in these questionnaires, we learned that there are countries who collect some of these data, but not all of those data. So for example, Cambodia collects data on helmet wearing. We have Australia who collects speed data, among many others. So we also learned that, but the highlight here is that it's not just not all of the member countries have submitted questionnaires, but at the same time, for those who submitted questionnaires, there are also places for or points for improvement. Next slide, please. And finally, process and implementation indicators. And this is something that we tackled not just in the APRSO data report, but also in the annual report. And we've based this from data that has been submitted to the WHO back in 2016 and published in 2018 in the Global Status Report. So it's not really an updated data, but it's something that we can work towards updating in the future. So here is a snapshot of, for example, implementation indicators when it comes to road safety engineering or safety infrastructure. Next slide, please. And based on these data sets, from crash data to fatality injury data to safety performance indicators and institutional indicators, one of the activities that we did is to develop a repository for all these types of data so that each of the countries would be able to access those data for their own use, and for the APRSO to be able to analyze effectively these data sets. And we developed a driver instance for the APRSO. And for those who are not aware, driver stands for data for road incident visualization, evaluation, and reporting. It's a web-based and it's a web-based and open source system that allows geo-referencing for different types of data. For the APRSO specifically, it allows us to integrate road safety data among APRSO member countries. So for those with established database systems already, then the APRSO driver instance can then act as a linkage, or can link the database systems of individual countries so that it can be shown in a regional platform. Next slide, please. So, well, it's just in the really initial phase, initial stages. We just have a prototype that we hope to improve upon in the next few months or years. For one, since there is clearly a lack of disaggregated data or individual records or individual recorded data in countries, the first hope is to be able to compile together aggregate data. So just the number of fatalities, number of serious injuries for every country, and disaggregated by vehicle type or by age or by gender. So that level only, not on the geo-reference level. But hopefully in the future, once individual records and geo-reference records are available, then it's something that the APRSO can aspire towards, having a repository that will allow cross-country comparisons of geo-reference data. Next slide. So again, the future, our target for the future is to be able to ultimately use this data for research and intervention. So the hope is to not just be limited to having the perfect data, but the ultimate hope is to be able to use this. That's the most important. And ultimately, it's to save lives. Thank you, everyone. Thank you, Dave.
Eric, thank you very much. Please hang around for Q&A a little bit later in the session. Particularly interesting to talk about the serious injury data that you mentioned, which I think will be another step up in challenge for us. Okay, next we are very fortunate to have Nan Tran from the World Health Organization join us. Nan is the head of the Safety and Mobility Unit within the Department of Social Determinants of Health at the World Health Organization. Nan will speak to us about the platform for road safety data reporting that supports the World Health Organization's global status reporting. Welcome to you, Nan, and particular congratulations to you and your team on the launch of the 2021 to 2030 action plan last month.
Thanks very much, David, and apologies for my tardiness in joining. I misunderstood the time differences. As David has said, I'm really excited to just share with you our progress towards actually updating the way that we collect and report on road safety data. And I just have a few quick slides that I want to walk through, but this is just an update on where we are. But I also wanted to take this opportunity to let colleagues know that, as you all know, the Decade of Action was launched last week, along with a new global plan. And as part of that plan, WHO has once again been given the mandate to monitor progress made by member states. And we will be starting this process in 2022 to produce the first status report on road safety for this new decade. And the report will be published in 2023, and it will reflect data for 2021, which will serve as the baseline for this new decade. So this process will be starting in 2022, and we will be, as we have done in the past, reaching out to member states and working with you to identify the relevant national data coordinators to complete the survey that we will be implementing. One thing that is different this time around is that we will be using this new data platform that I will quickly walk you through in lieu of the paper and email surveys that we used in the past. So one of the challenges that we had, and let me just go ahead and share my slides and see if I can make this work. I believe hopefully you're seeing my screen now, and let me just go on to, I think you're seeing my screen. It's not ideal because it's just on it, but anyway.
We can see your screen
one of the challenges that we had previously when we did the data collection was that everything was done manually. We sent out surveys via email, and we asked the data coordinators in each country to coordinate the responses to those surveys. In addition, we also requested from member states copies of legislation and policies in order to be able to verify them. And that was a very manual and laborious process. It also meant that there were lots of lags between when people sent in documents and things like that. So what we strived to do was to actually enable data collection that was more real time. And we also wanted to facilitate the communication within countries so that, for example, in some instances, the Ministry of Transport provided some responses. In other sections, for example, questions that related specifically to the provision of post-crash care, those questions were filled in by Ministry of Health colleagues. And so we wanted to have a platform that allowed different users to be able to interface with the system, so that the data collection could be done. So that the data collection could be done by multiple users, and that there would be a process whereby the responses that were provided by the different users could be validated. This is a very small slide, and I really apologize about that. I'm trying to see how I can make it bigger, but it's not working on my screen. But the idea here is quite simple. So this process basically just lays out the process of data entry. Up here on where my mouse is, this is where we start. We have a survey that's being implemented, and then the survey is sent out to country representatives. So it's up to the countries when you identify your national data coordinator, much in the same way where you have focal points for the Asian Pacific Regional Observatory, to decide who should answer the questions. and you can appoint up to 1, 2, 3, 4, 5, it doesn't matter. The system actually allows you to actually have multiple contributors. So for example, if the survey you feel should be answered by 3 different people, it's possible for you to allow 3 different members of your government to fill that out. So you might want to say that for the post-crash care questions, that should be Ministry of Health. For the questions about enforcement, that should be police, and some other questions might be the Ministry of Transport. But we leave that to you to decide and to coordinate. And the idea behind this system is quite simple. Basically, it allows everything to be managed through this process. So I'm sorry, again, the screen is quite small. I had technical issues this morning. The idea is that once the data has been entered into the platform by the contributors, it's up to you to designate a person at the country level who will validate all of the responses. So in the past, we've asked you to have a consensus meeting whereby you all get together and then you all discuss and agree upon the answers. This can be done virtually through this platform so that you can, in principle, have this discussion and exchange with your colleagues via this platform and agree upon the answers. Once those answers are agreed upon, then you will submit that into the system, and then it then goes to the regional office, who then has an opportunity to verify the responses and also get back to you with any questions. And then once that has been done, it goes to a headquarters to us. And then we then process the data, and then we analyze the data as we usually do, and then we come back to you with questions. So the expectation and the reason why we're doing this is that we want to be able to facilitate this process of communication with countries. And the other reason why we want to do this is because we want to be able to facilitate updates to your data. So in the past, sometimes when there has been disagreement between the numbers that are generated by WHO and member states, there's sometimes a process whereby we have a validation whereby we get back to you with questions and so forth. What this system allows us to do is to have all of those exchanges online through this online platform completely. And I won't go through these slides because I think it's a bit premature, but I just wanted to say that at this time, we are currently pilot testing this new data collection platform. And we will be, once we have completed the pilot testing, what we anticipate is that we will use this system starting in January, February of next year to actually initiate the data collection for the new status report. And we will be providing much more detailed instructions and tutorials on how to use the platform, how to create users, at which levels you need to do that. What I wanted to do today was really just provide a very quick update and overview on where we are, and to let everyone know that we will be using this new platform as a means of collecting data for the next global status report. And of course, we also are integrating this platform for the data collection that you'll be doing for the regional observatory as well. So one of our intents is to actually further integrate the 2 data collection processes, because some of the data that we will be collecting for the purposes of the status report will be similar to the data that you will be presenting or sharing through this regional observatory. So our idea is to make this system and platform available so that when you collect the data, you don't have to enter it twice, and that the data will be stored in one central repository. So that's really what I wanted to share this morning. And again, it's just really an update to let you all know that the next status report will be coming out in 2023. We will start the process of data collection in 2022, and we will be using this new data collection platform. So I'm sorry my slides are a bit not working well today, but I hope that gives you a bit of an overview in any case of our plans for the coming months. Let me stop there, David, and perhaps if there are questions, I can answer them.
Thank you very much, Nan, and thank you for that overview. And we really look forward to that system up and running and seeing its benefits. We will go to Q&A in just one moment. If you could stay with us for 5 or 10 minutes, Nan, that would be greatly appreciated. I'm going to do a very short presentation to set some context, further context for our Q&A. Looking at our road safety indicators and how we might populate these for the observatories. Michelle, do you have that presentation now? Terrific, thank you. And let's go straight into the next slide. So firstly, I just wanted to remind people of one of the views that Mirik showed us of the multiple levels at which performance indicators can be usefully developed. We're of course very familiar with the results and outcomes in terms of fatal and serious injuries. Interventions also as it relates to a program level, but somewhat less so on institutional management functions. The key message from this structure is that the strength of interventions relies on the strength of our institutional management functions, and the strength of our results depends on the strength of our implementation of interventions. So there's a deliberate hierarchy in this system. Next slide. In the results outcome indicators areas, we're talking here about numbers of crashes, injuries, deaths, and of course their costs. We have a large variation across Asia Pacific countries, as Mirik was showing us. These indicators are heavily dependent on resourcing at the crash scene and the collection of immediate data relating to the crash. Daily data collection needs to be a standing capacity of countries to be able to do this well. It draws on links between data sets, between road users, vehicles and trauma through hospital trauma units, in addition to what police are collecting at the scene. And best practice in this area is to use quite sophisticated integrated systems and data collection tools. Next slide. Safety performance indicators at the intervention level. Here we're talking about measuring the transformation in the road system itself towards the safe state that we're targeting within our strategy. These are less commonly used at the moment across Asia Pacific countries, but they can be very important to measuring the progress at a program level. They depend heavily on observations in the field and surveys of road users. These can be done on a periodic basis, occasional data collection to a consistent methodology to allow comparisons. They're sensitive to situational factors quite often. The methodologies need to be carefully implemented and designed. Best practice here applies repeated use of set methods using randomization across the road system. In the vehicle safety space, best practice is to collaborate with manufacturers and importers to get a clear picture of the safety features across the fleet. Next slide. And on process and implementation indicators, these are some of the ones that Anna was speaking to us about earlier today, measuring progress and policies, programs, budgets, and the whole processes of decision making. These are rarely used across many of our countries. They look at internal business rules and practices of government agencies. These things are often not revealed well to the public. They're often not even well documented within our organisations, and so it can be quite difficult to create indicators around. They ask both, are policies in place, but also are they being effective? They are a point in time collection that give us a snapshot and allow us to focus our improvement efforts. Best practices here uses a capacity review process to identify improvement, and hopefully in the near future we'll also be able to use the assessment tools that the ITF and World Bank are developing. Having independent expert assessment is often very important to set these indicators up well. Next slide. So over time, the APRSO is interested in helping countries individually and collectively move through this process of starting with what we have right now. There is really nothing stopping us from starting the process of data collation, collection and use with whatever information we have now, even though we know it may be incomplete and not what we desire. It's what we have, and that's where we start from. Over time, we can improve our data collection, build our knowledge sharing, start targeting research on interventions, collaborate amongst other countries, particularly do evaluations to build greater evidence, and introduce new technologies and tools into the data management process. Next slide. So thank you, Michelle. Let's close that down and we'll go to some questions for our panel members. Please, can I encourage participants to post into the chat any questions that you might have. I wanted to start with a question to Nan and then to Mirik, really, is what do you see as our data collection priorities, and where might be the easiest places to start to have early success? So what are our greatest priorities? Where can we go to have our quick wins?
Thanks, David. I think from my perspective, and let me start by sharing my perspective. I think obviously from my perspective, the biggest priority, of course, is to improve or harmonize the collection of data. And I say this somewhat carefully, not to suggest that the data collection by member states is bad, but rather to say that we recognize that when we've worked with countries that within country that the reporting of road traffic deaths is inconsistent. Some ministries use different definitions, some ministries, and they have different protocols for collection. So one of our first priorities is to actually harmonize the data collection and the reporting of road traffic deaths within countries. And I think this morning, for example, what Kassem presented is a great way of achieving that harmonization across different sectors within government in terms of aligning the data collection and the reporting. So for us, that's one of the main priorities. Obviously, beyond that, in terms of looking at number of deaths, the second thing that we have really struggled with, and this is universally true for all countries, is actually the reporting of injuries. We have very limited data on injuries, and the deaths, we have understood how to perhaps improve the capture and improve the harmonization. But when it comes to injuries, this remains quite a struggle for a number of reasons that many of the colleagues here already know, as you are experts in these fields. Obviously being able to capture injuries, being able to record injuries according to the severity, all of these issues pose enormous challenges. And the problem for us is that we know that, deaths represent a huge part of the burden, but we also understand that injuries themselves actually, pose potentially even a bigger burden in terms of the impact on health and lifelong disability. So not having good data on injuries really hinders our ability to address this problem, but it also really hinders our ability to advocate for more resources, including, for example, in rehabilitation, as well as services for disability. So for me, again, speaking only from the perspective of WHO, that has a much more health-oriented focus, I see obviously the importance of being able to harmonize and improve the reporting of deaths. And the second thing for me, obviously, is really around the ability to capture and report injuries. And the third point is really about understanding the risks and being able to disaggregate the deaths and injuries according to the contributing factors. And again, this is something that worldwide we don't have a lot of data. I noticed that Mirik had presented on the voluntary performance targets just before I was speaking. And you'll note that a number of those voluntary performance targets and indicators speak specifically to things like speed, reduce the number of crashes and deaths and injuries attributable to speed, attributable to drink driving. And of course, our ability to actually achieve those targets and indicators depends a lot on our ability to be able to have data that disaggregates and attributes the cause of death or crash to those specific risk factors. And as of now, we don't have a lot of data on those things. So for me, it's those three things that I would consider priorities for data moving forward. Thanks.
Thank you, Nan. Mirik, how would you respond
Yeah.
to that? What are our priorities across our APSA members?
Well, for me, first of all, I agree to all that Nan has mentioned. I would just like to add some of my priorities based on my experience with working with different countries. I think for the individual countries, the first priority is to be able to convince top officials to really prioritize the improvement of data, because it shouldn't be an ad hoc activity. It should be a well-programmed, long-term priority of the government, because it involves many sectors. It involves funding, sustainable funding. It involves training, from crash investigation to the basic understanding of road safety, even to the basic use of technology, of computers. It's something that has to be recognized by top officials of the government, so that a long-term sustainable plan is being done and implemented. So that's one. And the other one is to elaborate more on the safety performance indicators. These safety performance indicators has a proven link, direct link, to the reduction or the worsening of road crash fatalities and injuries. With the lack of crash data, actually, countries can already leverage on collecting speed data, for example, for major corridors, and it can be a one-off thing, so that future activities or future interventions can endeavor to lower the speeds, for example, for these major corridors. Or Greg is here. I've seen him in the participants list. There are countries which have IRAP data, or International Road Assessment Program data. And usually after these assessments, these countries actually doesn't follow through with the recommendations from the IRAP data. So another quick win for countries is to be able to make use of existing data sets that they have and follow through with the recommendations. And with that, they would already be able to make impactful decisions in road safety.
Thank you, Mirik. And thank you to Nan and Mirik for presentations and responding to questions. It is time, however, for us to bring it to a close for today. Very importantly, next steps for our national data coordinators are really a focus here on addressing some of the collaboration capacities that we know are needed based on strong leadership and governance, to allow us to start to harmonise our data collection practices. A big need to improve fatality data management, but also to start addressing injury. In the meantime, there may indeed be some low-hanging fruit in the performance indicators that are used to show us the change in the road system at that interventions level that Mirik has just referred to. This brings us to a close of day one. I'd like to thank all of our speakers and presenters, and especially for the participation of our audience. I think we've got across most, but not all of our questions. So my apologies if we have left yours out. We'll go through the chat and try to get to some of those too. Tomorrow we commence at the same time, 1 p.m. Manila time. Our themes for tomorrow are collating road safety data across Asia Pacific and the potential role that our sub-regional groups might play in improving data collection and use. So good day to you all. It's a pleasure to have been with you today. Thank you from APRSO, and I look forward to seeing you tomorrow. Thank you.